country unanimously agreed to suspend payments through the National Hospital Insurance Fund and insisted on cash payment. And as Ian Keitani now reports, this comes after the lapse of a 60-day period given to the government by the hospitals to solve this stalemate.
At least 80% of Kenyans who depend on the National Hospital Insurance Fund could soon fail to get medical attention in private hospitals across the country due to the ongoing tussle between private hospitals and the NHIF board. The Rural Private Hospitals Association of Kenya has instructed all private hospitals under the association not to admit patients using the NHIF cover unless they are willing to make their payments in cash.
NHIF tunalipa kila mwezi. Tutafanya aje sasa? Sisi watu wasiojiweza tutafanya namna gani? Sisi wala hatuna namna. Tumefanya kazi, tumelitaya, tuko nyumbani na tunaendelea kulipa NHIF. Na sasa ati hatuwezi tibiwa kwa private. Kwani private ikipotea, tutatoa pesa wapi tuende kutibiwa? Serikali, Ruto, tusaidie tafadhali.
With the insurance fund owing hospitals at least 20 billion in payments, the manager at Hosome's nursing home, a private facility in Nyamira, blamed the NHIF board for failing to remit the funds, a move that he says hindered operations within various private facilities.
These companies, these payers, they affect our operations in a great extent because we treat their patients, they pay us later. But we are facing a serious challenge when it comes to payment, and this has grounded most of our operations. And if you don't get the monies that you have spent for patients, even getting quality service, offering quality service to this patient becomes a challenge because essentially there is no man to run the hospital. There is no man to pay salaries, so you'll find out you have demotivated staff. You find you have no money to pay your suppliers, so you find some drugs cannot be supplied.
Abuga was critical that despite employers remitting employee contributions, the fund had failed on its part in replicating the same.
Employers are remitting this money, people are contributing, but the way the fund is being run personally, I say there is a problem which needs to be addressed. So I'm appealing to the government. If sincerely speaking, the government is caring about the welfare of the citizens, healthcare is a #1 priority. Because if the government can take time and work on these essential services to ensure that all hospitals who are contracted by NHIF, they are paid in good time, we'll have a very healthy country.
As the tussle between private hospitals and NHIF continues, patients are set to pay the price due to lack of remittance, as many of them lack funds to privately finance their medication.
Kama vile tulikuwa tunalikuja kitambo tunalipiwa NHIF na tulipia pesa. Sasa hatujui ni nini imetokea saa hii. Tumepona tuko hospitali, NHIF tunangojea message. Hii pesa tunalipa kila mwezi. Inaenda wapi? Kama mimi nimelipa paka 2024 December. Hiyo pesa yote NHIF inaweka itaki kutulipia tutoka hospitali. Sasa Ruto, tusaidie.
However, acting NHIF CEO Samson Kihora has taken a swipe at the association, citing a violation of the contractual provisions on the part of the hospitals, insisting that eventually the funds will be remitted. Ian Keitani, Look Up TV.